Okay, I think we should get started because we only have less than an hour now to have this panel, and people will trickle in as they come. Again, thank you all for being here. This is our panel discussion on developing significance and innovation sections for tobacco regulatory science proposals. This is the second of such panels that we've had. We had our first panel earlier this year on developing specific aims pages for NIH applications for tobacco regulatory science. And today we're going to do one on these two sections, significance and innovation. And in the next few months, we'll address the approach section. And these events are all going to be recorded, of course, and be available to folks to view as they get into the writing of their proposals as part of a resource toolkit for grant development. So welcome again. And I just want to take a few moments to introduce our esteemed panelists. We have three panelists today. One from the NIH, Dr. Stephanie Land, and then Dr. Adam Leventhal from USC, University of Southern California, and Dr. Jamie Tam. I'm just going to give a few brief statements about these individuals' backgrounds, and then they'll be given a few minutes to talk about some introductory comments regarding themselves and about approaching these sections of an NIH proposal. So Stephanie Land is the Program Director and Statistician at NIH, NCI, Behavioral Research Program. Her area of focuses are tobacco use among patients in the settings of cancer prevention, screening, treatment, and survivorship. She serves as the American Association for Cancer Research, Tobacco and Cancer Subcommittee, and is the chair of the NCI AACR Cancer Patient Tobacco Use Assessment Task Force. She's a lead of the NCI Smoking Cessation at Lung Examination Scale Collaboration, and she's also the NCI lead for the Cancer Center Cessation Institute. Okay, and Dr. Adam Leventhal is the director at USC Institute for Addiction Sciences, and he's a professor in the Department of Preventive Medicine and Psychology at USC. He directs, his research interests include adolescent and young adult substance use epidemiology, addiction in priority populations, science to inform public policy for regulating tobacco and other addictive substances, and cancer and cardiovascular disease prevention. He's a PI of the USC T course. So congratulations, Dr. Leventhal, on that success. And he's been awarded over $60 million in research grant funding and has authored over 300 peer-reviewed publications. Dr. Jamie Tam is an assistant professor at the School of Public Health at Yale. And her work focuses on simulation modeling to examine domestic and global tobacco use disparities with attention on populations with behavioral health conditions. She's an investigator of CISNET, the Cancer Intervention and Surveillance Modeling Network. She leads research to evaluate long-term impact of policies such as graphic health warning labels and T21 policies. She's also an investigator in the eCourse 3.0 at the U of M, Yale, Georgetown, and BC Cancer. So we're very pleased to have you all as panelists in our session today, and we are really thankful for your time and support. Just a quick view of the agenda for today. I'm doing my introductory comments here. Then the panelists have a few moments to give general advice about significance and innovation sections of tobacco regulatory science grants. And then we'll have 30 minutes of Q&A where Dr. Mendez and myself will ask questions to the panelists, and the audience will have an opportunity to ask questions by raising their hands or using the chat function. We'll give panelists a little bit of time after the Q&A to make some closing remarks, and then the last 10 minutes will be devoted to tip sheets that Dr. Ella August has put together about writing significance and innovation sections. And we'll do a few minutes of next steps, what we're going to do next as part of this series. So welcome all. Let's all get started. And we'll start off with maybe Dr. Land taking a few minutes to talk about general advice around writing these sections of the NIH proposal. So I'm going to stop sharing. And Stephanie, when you are ready, you can start sharing and get started.
Great. Thank you so much, Ritesh. I'm very delighted to be talking with this group today and to collaborate with Castor generally. Let me get this slide set into presentation mode. And let's see, is that the right view or do I need to switch?
We see the speaker view.
So what if I do that?
That's perfect.
Good? Okay, terrific. And yes, so again, delighted to talk with you about developing significance and innovation sections for tobacco regulatory science proposals. And I have a few slides here to highlight some of the differences between those sections for tobacco regulatory science proposals versus more general NIH applications. And as with all NIH applications, criteria include significance, investigators, innovation, approach, and environment, but the two sections we're talking about today are the two that are modified for tobacco regulatory science proposals. And brief overview on that is that traditional applications, the significance and innovation criteria are not quite entirely applicable. So for example, improvements to clinical practice, clearly not so relevant for TRS proposals. Preventative interventions may not be appropriate for CTP funding. And the novelty of the project may not be a high priority for some opportunities. I would caution you, though, not to assume that that's true in general, but to look to a specific notice of funding opportunity and read the language there to make sure that is true. And there are some nuances when we say that the novelty is not as high a priority. So I want to come back to that in just a minute. Turning, though, first to significance, the tracking here shows some of the changes from traditional NIH applications to the TRS applications. So instead of problem, we have issue, and it's asking whether something is a barrier to the field, not necessarily a barrier to progress in the field. And looking at the third bullet, clinical practice, again, not so relevant for TRS applications. And then instead of asking whether the successful completion of the project or of the aims will change the concepts, methods, and technologies that drive the field, we're asking whether those affect the concepts, methods, and technologies related to the manufacture, distribution, and marketing of tobacco products. And then turning to innovation, turning to innovation, the first bullet is changed again, removing some of those pieces that are not as relevant for tobacco regulatory science proposals and swapping in the criterion of whether it seeks to shift current research in the field of tobacco science related to manufacture, distribution, and marketing. And then the second bullet is again we're not focusing as much on whether it's novel in a broad sense, but whether there's a refinement, improvement, or new application of theoretical concepts, approaches, methodologies, or instrumentation, not again focused on interventions. And then a new bullet item, which is, will the outcomes of the project provide new information to further develop the knowledge base that informs the work of the Center for Tobacco Products? And the nuance I wanted to mention is that while there's less of a focus on novelty in the scientific field, which is typically thought of relative to the research base that's been published, there is, however, an emphasis on whether your project is novel with respect to what's already been funded by the Center for Tobacco Products. And that can include projects that are recently funded and have not been completed, have not been published. But if the Center for Tobacco Products has already funded a large initiative that addresses a particular question, they may not be able to fund another project on that same topic, even though the first project isn't yet complete. And that's a little different from how typical NIH research funding works with respect to novelty. So I'm going to stop there and turn it back to you, Ritesh.
Great. Thank you so much, Stephanie. How about we move to Dr. Adam Leventhal, to say a few things about writing significance and innovation sections for TRS applications.
Sure, happy to. I think, let's see, there's a couple things to think about when approaching these, at least that I think of. And this is just my 2 cents. So remember, like, everybody will have different strategies, and theirs may be more appropriate for you and your work than this one. So take that with a grain of salt. So a lot of times, especially now, the reviewers may be not as familiar with tobacco regulatory science as the reviewers of your grant, as especially the trainees are getting explicit training in it. So with that, in order to describe the significance of your project, sometimes it helps to do some education about what FDA and CTP can and cannot do. And what also can be helpful is to describe the precedent in terms of the types of actions that FDA and CTP has engaged in the past to show that this project has a capability of impacting FDA regulation or communication, because as shown in this other example, which is similar to mine but not the same thing, it did previously, right? And then I think in terms of more specifically, and one of the key areas right now where I think tobacco regulatory science can be very impactful is to inform pre-market tobacco, PMTA, the applications to market, right? And so they can use data from TRS studies, even if it's not on the product that is and the company that's submitting their application. They can use your research to inform whether or not they will authorize or not authorize. And so sometimes that's useful. And this is for, new products that are new in the sense of, I think, post 2007. But Stephanie may have I would trust her word better than mine. And so, anyone who's working in e-cigarettes or nicotine pouches and some of these novel products, that is, I think, an approach, and it's very helpful to, I think, sometimes explain that. And then in terms of innovation, the reviewers, reviewers do like innovation, and it can be hard. And so if there's a way to do something that is intriguing, that kind of natural innovation that maybe we're used to talking about for science more generally. So like the stuff that was red crossed out for Stephanie's modification, just remember that the reviewers may have that feeling, whether it's implicit or not, that they're kind of expecting that, right? So A, maybe education, and B, to the extent to which you can pull it in, and of course, make sure that you're doing something that's within the realm of CTP authority, that is ideal. So I'm not suggesting that you should say that you are going to discover a new mechanism that has nothing to do with regulation. Do not do that. But if you can generate some intrigue, especially with methodology, I think is an easy place to go. And apply it to TRS, that is a good potential strategy.
Great. Thank you very much, Dr. Leventhal. We're going to hand it over to Dr. Jamie Tan to say a few words from her view.
Yeah, sure. So my advice, I think, in some ways is quite similar to Adam's, but and in the sense that I think when you're writing, you're educating your audience, your reviewer, about what FDA can and can't do. But I think even before that, educating yourself about what FDA can and can't do is very critical. And I think it means going beyond understanding what product standards are going to come out. It means in terms of prioritization, how is FDA investing its resources in terms of enforcement, in terms of, maybe they plan to pursue a product standard, but if they don't have this specific information, they might go about it the wrong way, or they might not be able to do it that successfully. So I think understanding FDA's powers and authorities, and also how to it's less about, I think, yes or no, should the FDA take this action, and more about, well, how should FDA go about taking this action? And will your research inform the how of that? So I think that is sort of the kind of background research that helps to sell the significance to your viewers, but also helps you come up with better research questions that kind of get at, well, what is actually going to be influential? What's going to, change how a decision gets made? So I think that's maybe I think that is definitely a priority. And and sometimes I think when people go in for, start to write an applications because they already have an idea, and then you already plan to pursue the idea, and then you write a significant section around that idea, instead of thinking, well, what is needed? What would add value? And can this research question add sufficient value? So it's a kind of of course, you go in with your specific research idea, but I think as you're writing the significant section, parts of your research strategy will become maybe more or less important, or parts of your proposed project will become more or less important. The other thing I did was, as I was writing the significant section and I was outlining problem 1, problem 2, problem 3, I made sure that I had a mental list of all the problems, and that in the rest of the research strategy, I actually solve all those problems. So that that way, when you write the significant section, you're setting up you're outlining the scope of the problem, the sort of what aspects of the problem need to be addressed, and then then it's going to make the rest of your application look really good, because you've constructed the problem to fit your solution. So I think that's maybe what I would say on the significance side. On the innovation side, I think that when I was writing initial drafts of my research strategy, the feedback I got was that I was underselling what I was putting together, and the feedback I got from senior reviewers who are sort of senior faculty was you should just make a list of bullet points, and the first 5 words of those bullet points are, this is the first study to do. This is the first time, blah, 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 blah. And so once I had to think, wait, in what ways is this project the first of its kind? That kind of forced me to articulate what was actually innovative about the proposal. And so is the language I think there's something to be said for simple, very direct, to the point language delivered in bullet point format. Because that's what reviewers want, you to make it easy for them.
Great. Thank you, Jamie. I have a request to the audience. If you can at all, turn on your videos. I think it would be much a better experience for all of us, especially the panelists, to see everybody's faces as we have this discussion, because we're not going to be selling too many slides and things like that as we move forward. If at all possible, if you can do that, that would be great. Okay. So we're going to start our Q&A portion of this session. So we have some questions that says David Mendez and I came up with for the panelists. And so we're going to ask a few of those, but we would appreciate, more importantly, we'd appreciate questions from the audience to the panelists. So please, you can type in your questions in the chat. You can raise your hand and we'll call on you to ask questions. It would be nice to have an interactive next 30 minutes or so of the time we have together. So the first question I have for the panelists, David Mendez and I will tandem. I'll ask one, then David will ask one. The first question I have is, what are the key qualities of a great significance section as opposed to just a good significance section? From your view, what is like a one that you're reading, wow, this is amazing, versus something that, this will pass? What are some qualities of that type of a significance section? And then you can say the same kind of thing for an innovation section. Any one of the panelists who wants to chime in first?
Punchy, direct sentences in active voice. I have read some drafts, and when the sentences are long, I'm bored. When the sentence is half the paragraph, I can't remember what happened in the first part of the sentence. And so I think language and sort of like style makes a difference in terms of how your work is going to be received. So sentences can be shorter. And I think we academics and like research scholars have a tendency to get very wordy unnecessarily.
Absolutely. Thank you, Jamie. Others?
Yeah, that's hard, right? It's so short. Without him sounding like too much staccato. So we should take tips from Jamie. I guess the other thing is that we can that might be relevant, especially to this group, the focus of Castor too, is you can put in raw population numbers of people impacted by your work, right? And so if it's like, if we find this and that leads to this regulatory switch, up to X hundreds of thousands of people who use product Y may be impacted. So that might be another way to do it. But I really like the bullet point. I think that's a good strategy. I've been trying to use that for the innovation sections, just bullets. That's it now. Because remember, what do reviewers need to put on their reviews these days? Bullets, right? So if you kind of give them a cue, that's good.
Yeah, I'll just jump in and say I really like everything that's been said. I completely agree. And I think making it very clear what is, the public health significance, what is the unique question that's being addressed, and that needs to be addressed in order for CTP to do its work. So there are three things there. And I think Jamie mentioned showing the draft to senior scientists who have successfully proposed research. I think that's extremely important because, you want to make sure it's going to come across as clearly as possible.
One thing I'll also add is, I think one way to kind of a significant section going from good to great. Explain what happens if this research doesn't occur. What are the consequences if your study is not completed? How does the absence of funding your project lead to a worse outcome? So I think that sort of that creates an impetus for funding your project because think about the consequences if they don't.
That's great. That's great. Thank you, everyone. David, do you want to ask the next question?
Sure. So we talk about factors that improve, that make it great, that significant and innovation section. What are the red flags? What are the things to avoid? What are the things that you definitely don't want to put in there that will create some kind of adverse reaction from the reviewers?
David, I'll just comment that, of course, with tobacco regulatory science proposals, number one is responsiveness. And we have resources. I can actually share a slide on that, if that's okay. we have resources to help you determine whether an idea is responsive, and know that and it says it here, if even one aim is not responsive, the entire application cannot go forward. And so the staff at NIH are available to help make sure that your work is responsive. We encourage you to talk to program staff when you have a set of aims that you'd like to propose, and also that you submit those aims with a letter of intent 60 days prior to the submission date. And you'll note that that isn't actually written publicly. We don't have it out in public-facing information saying that aims are required, because we cannot require them, but we really hope that they will be submitted so that we can help you make sure that the application is responsive before you send it in. So I would say, for me at least, that's the number one point to get across.
Thank you.
Let's see. Oh, and Jamie's comment about enforcement priorities, that's really good too, because if you it related to, I think, what she was saying too about the like, if you don't fund this research, what would happen? Kind of like, enforcement priorities, FDA has only so much resources, and, if they don't know what the biggest priorities are in terms of public health impact, then they can't dedicate those resources effectively, right? And so that's kind of related to that approach. And things not to do, it just would be don't just review the literature. That's a literature review. Your significant section should be an argument why the things are significant, and again, I like Jamie's approach to this significant, because like, this is the problem, this is the problem, this is the problem. So maybe you have 3 or 4 or 5, or maybe 2, I don't know, and then at the end of your significance, this proposal addresses these barriers. So,
yeah, I was going to make a similar comment. You're not writing a list of things. You're not writing a list of facts. You're composing a series of arguments. And so usually in the first paragraph or the first 2 paragraphs, that is sort of like, you can tell very quickly what kind of proposal this is going to be based on whether it's very listy or not. And I think if what you have at the beginning is a series of arguments, then the rest of your research strategy becomes a story. Like, this is the arc of like what's happening. Whereas if it starts with kind of listy, like, you can kind of already like, you can make a guess as to what the rest of the research strategy is going to look like, and it usually is not as focused, I think, as one that starts with a series of arguments.
Yeah, I mean, I agree. And related to that, don't assume that your reviewer has a base knowledge about the importance area, right? And so sometimes people will take that for granted and say like, oh, because they're so specialized in their field, they think everybody appreciates this. And so related to that too, if it's really simple, even if it sounds so simple that it's just like, oh, is this fancy enough? I mean, it probably is. And so you want, obviously, the like an undergraduate student maybe to read your significance section and understand like that and agree with your argument. And, undergraduate or English literature major will say.
Yeah, and you also have to keep in mind that the cognitive burden to your reviewer as well. When they're reading lots of applications, they've got other deadlines, they're speed reading. You don't want to, you want to make this as easy for them as possible.
Yeah, agree. I mean, the strategy, like the bold, the underline, how to get that really nice balance, which is hard. You don't want it to be all underlined, because then no one we'll take the underline seriously, but that's another strategy. If there's no underlining whatsoever, you just got to be, that means like there's some people who are really, really great grant writers and they don't need it and they just have paragraphs, right? And without these kind of labeled subsections, but I'd like to do a lot of labeled subsections and spoon feed the structure for the reason that Jamie was talking about. The cognitive burden is reduced if they're primed to say, okay, well now this subsection is going to be on this topic. That's, half a sentence.
Great advice. Audience members, please, if you have any questions, raise your hands, type it in the chat. These folks are here for you, so you can, get as much advice or input from them while they're here for the next 30 minutes. In the meantime, I will ask the next question. I think this was addressed by Stephanie through her slides a bit, but I think a lot of us, maybe even the trainees here, are probably trained in writing grant applications that are maybe more for a general audience or a non-regulatory science audience. From your view, what are the key differences when you think about writing these sections for a TRS application versus a non-TRS application? I know some of the things were mentioned in terms of what the NIH criteria or guidelines are in terms of writing these sections, but when you're really writing these, do you have a different mindset when you write? Are you maybe thinking more in terms of a practical or a policy application at all points when you're writing? How is this different when you write as opposed to a non-TRS R grant or a K grant?
That's a very good question.
We have other experts in the room. I'm going to call out Dr. David Levy and Rafael Meza. If you have suggestions to these answers or responses, we'd love to hear from them as well.
And I'll just say one thing. In one sense, in this way, it's not if you're doing clinical research and you say, if we find this, doctors can do this, right? Or this will be this treatment will be disseminated. It's kind of the same thing as if we find this, then regulators can do this.
Maybe because I think we've talked about how like the people who read your application may not know a whole lot about FDA's regulatory authority and what falls under their jurisdiction or not. So you kind of have to like sell to them. But I'm from what I understand, people at FDA do eventually read the applications themselves. Like the FDA does play a role in looking over the proposals, and so I think making sure you can speak to both audiences is, I think, maybe different than if you're writing a more general NIH grant, because you're not writing a general NIH grant thinking, oh, the state level policymaker is also going to read this over. So I think keeping in mind that FDA will have their eyes on your applications as well. I think maybe that's one way I approach it a little bit differently from other grants. We do have a hand raised.
Great. Buki, please.
Yeah, hi, Josh. Thank you so much for this webinar. I think my question is more in line with what you just asked. Typically for NIH, when people think about R01s, they think interventions, or they think, something that can be implemented for a specific population or something like that. And when you talk about responsiveness or the authority of the FDA, are there like boundaries maybe you can think of and say, okay, don't bother doing any research that has to do with making policies for retail store owners, or don't bother doing any kind of research that has policies that will involve governors or something? What are some large boundaries that you're like, just don't go beyond this? And because I saw in the slide that you had, the interventions were struck out. So now interventions is not something to think about when you think of an R1. So what's the major thought process when you're thinking of an R1 for this kind of grant? I know I said a lot, but I hope you understand what I'm saying.
Yeah, maybe I can speak to that, and then others may want to as well. But yes, there are absolutely some very clear boundaries because of the authority that the Center for Tobacco Products has. They can't just choose to fund research that is outside of that authority. So they really are limited in that regard. And there's, I guess I don't know if we're sharing the slide again. There is a resource that we have that provides the latest on what those responsiveness boundaries are, and I'm sure we can make sure that slide is available, so you have that link. But then the NIH staff are here to help as well, to make sure that everything is clear with respect to whether you're inside or outside of those boundaries. So again, it's about, yes. Okay, so Jamie, yeah, let me turn it to you.
No, I was just putting out, like, there are a couple of no zones when it comes to FDA responsiveness. I think taxes are really tricky. I think smoke-free air laws, those are all sort of state level powers. Marijuana is very difficult because so many people are vaping marijuana. I think that, yeah. So that's great. I'm glad that you put that in there. I think if your project touches on some of these topics, you have to make the case for why that's relevant to something FDA has the power to do. I mean, I would say, those are kind of danger zones, but if you were going to, let's say you have to control for this in order to look at the effect of something that FDA does have the authority to make decisions about. I think that those are sort of situations where it might make sense. But yeah.
Yeah, absolutely. And there is a nuance about all of this. So for example, as is listed in the chat, developing an approach for cessation to provide cessation services is not within their regulatory authority, but understanding how a policy change might affect cessation is in their regulatory authority. So it's not, we can't say cessation is, can't be included. It's just a question of a more, I guess, drilling down into what's actually being studied. So it does get a little bit complex, and I'll put that link in the chat as well.
Yeah, and I think it's also helpful to read through the RFAs because, for example, I remember several RFAs that said research on graphic health warnings not responsive, and it's because technically it's under FDA's authorities to implement graphic health warnings, but litigation, they've already tried many times, or it's like a done deal. Those are reasons why it's no longer a research priority. And so that's why that's non-responsive. So I think paying attention to that language matters. So I interrupted someone. David, were you about to say something?
I'm just going to pop in and note the time to our facilitators, Ritesh and David. We have about 4 minutes according to our agenda for Q&A.
Right, that's enough time for a couple of questions. Go ahead, David.
Following up on what you were saying, Jamie and Stephanie and Adam. So, what are there are clear difference between a general application to NIH and an application to TRS. So, what are the additional resources a person has to write a successful application, a TRS application? So on above and beyond what you can have for a general NIH application, what kind of resources or what of sources you need to go and familiarize yourself or have knowledge on?
Yeah, one One resource is the Public Health Law Center in St. Paul, Minnesota. They will have some synopses of the Tobacco Control Act, which is really helpful, and that's a really good place to start. And then they'll have other types of more like straightforward explanations of FDA's what's in their regulatory purview.
Mhm. Great, that's a great resource. Thank you.
I'll also just mention NIH Reporter, which can show you all the applications that have been funded so that you know both what's going on currently that may have already been funded by the Center for Tobacco Products, as well as research funded in your institution that might point you to someone who could be a senior mentor, a collaborator, or who could review your aims or even give you an example of a grant application. Great suggestions.
Louis, I'm going to call on you. I'm sorry hope you're able to talk. I know you submitted a couple of questions prior to our event. If you don't mind asking them, that would be great. Or else I can do it for you.
Yeah, I can do it. Yeah. So I'm thinking of, searching for opportunities to send my, my future application. And so far I have learned, some funding opportunities from CASO emails. So I'm wondering if there is if it is the only way that we learn about new funding opportunities, or is there any way or any other resources?
Yeah, this is Stephanie. I'm going to put a couple of links in the chat because we do keep publicly posted lists of funding opportunities that are NIH. And let's see, I'm going to have to figure out how to put that in there. And I also wanted to mention that, well, first of all, we have general parent announcements at NIH. So even if your particular idea doesn't fit in a specific opportunity, you may still be able to submit it. And if you submit an application that isn't already submitted to one of the tobacco regulatory science opportunities, but it's submitted to a more general NIH opportunity, but you think it is relevant for tobacco regulatory science, then alert your program staff member who's assigned to that application, because we're on the lookout for potential grants that can be funded by the Center for Tobacco Products. So it can go in that direction as well. So I'll stop there, and I'm going to try to put these links in the chat. But yes, if you just actually Google tobacco regulatory research funding opportunities, NIH and NCI, you'll find the links that way as well.
Mm-hmm. Yeah. Thank you.
Excellent. Thank you for your responses to these questions, and thank you to the audience for asking them. I think we're going to shift over to the next phase of the panel discussion. Now, we have a few minutes where we're giving each panelist maybe just a couple of minutes to make closing remarks, parting thoughts about how to do this and do this successfully.
I'll leave with we're here to help.
Just get some other successful grants from your colleagues, and then try to implicitly understand or explicitly ask them why they did certain things in their grant.
Great.
Yeah, this is, I think, revisiting this section, like even as you're writing the other sections of the grant, is really key, because you want all of it to be very cohesive. And you want to make sure that like every sentence in the significance innovation section is necessary and belongs there and fits in with the rest of what you're proposing. So, I remember when I started writing my KA, you write your significance innovation and then you write the next sections, but actually you need to revisit. And you need to revisit it like many times, and like I think the different sections of the application should really complement each other. And so what I said earlier about like problems and solutions, like am I writing these to fit with each other as opposed to having them be sort of separate, you don't want to kind of have them be disjointed, the different sections of your application. So writing the significance and innovation at the start and then revisiting it and rewriting it, and it will change a lot.
Great, thank you all. I'm going to hand it over to Ella for a few minutes now, Dr. Ella August. She's put together excellent tip sheets on how to approach the significance and innovation sections. So she's going to go through them briefly with you all. And then we're going to have David Mendez close the meeting off with some next steps and additional resources that we have for you all through our Castor TCOR site. Go ahead, Ella.
Okay, can you see the handout?
Yes.
Okay, great. So as Ritesh mentioned, the CEC has prepared 2 handouts, 2 tip sheets to guide the development of your significance and innovation sections. And we don't have a ton of time, so what I'm going to try to do is just go through one of the tip sheets to orient you to how it's organized and how you can effectively use them. And then you can just take time to read through them more carefully afterward. So this sheet is on the significance section, but there's another separate tip sheet for innovation. It includes some standalone tips, and it also integrates some good examples into some of the advice given in the tip sheet. And I'll circle back in just a moment and show you where you can find the examples and kind of go through that with you. But I just wanted to say that I think, I work as the sort of the writing person with some different groups, and it can be really hard to find examples of grant applications. And I just think it's so fabulous that people have contributed their examples. And it is a real strength, I think, of this Castor group to share those and provide those as a learning opportunity. So let me just start. As you can see here, we start with the NIH review criteria specifically for TRSP applications. I'm not sure exactly why, but there was a bit of a discrepancy in the second bullet of what's posted here and what we saw in Stephanie's slides. I'm guessing you have more up-to-date information than we did. This information is from the website address that's at the very end of the document. I won't, kind of dwell on that. It seems like they're getting at the same thing, but the wording is just slightly different. So, this has already been discussed, that these are unique for the significance and innovation sections to TRSP applications, different than the standard NIH criteria. And so the next section is just trying to sort of distill down and get specific about what is meant by significance for these types of applications. And so the next section includes suggested components to include in your significance section. And for these bullets, we integrated examples because that really helps you connect some of these, which might feel a little bit abstract, to concrete examples. So I'm just going to show you. Can you see my web? The cats are okay. So this is the toolkit. And how you can find the examples is you go to full proposals here, and we have used one example from Dr. Levy, and that is R01 modeling policy and use patterns. Yep, so it's this one here. And then we also use Dr. Tam's example, which is called Jamie Tam K01 research strategy, which is right here. Okay, so those, you can pull those out. And now I'm going to go back to the tip sheet just to kind of orient you to how this is organized. So this breaks down the different components. And so, for example, the first bullet talks about addressing critical barriers in the field. And you can see below that specific examples are tied to this main component, and there are examples for each of the sub-bullets. So, for example, if you wanted to see an example of an argument about the importance of the health problem being addressed, then you could look at Dr. Tam's proposal in her significance paragraph 1, et cetera. And so you can kind of work through those, on your own. And the next section on knowing your audience is sort of meant to help you tailor your proposal to the people who are reading it, obviously, and judging your work. So to familiarize yourself with the study section that typically reviews the type of proposal you're writing, you can use this tool, the assisted referral tool. And that's here. And it's linked to in this document. And it's an NIH tool that's interactive. And the idea is you enter information from your proposal and it helps you identify a potentially appropriate study section. So while you can request a particular study section, there's no guarantee we'll actually go to that study section, but you can ask. And then in the final 2 sections, I've included some general writing and formatting tips. Like these are also linked to the examples. I just love looking at examples, and I enjoyed reviewing the 2 examples so much. And you can, again, look at specific examples of these tips in the two proposals that I've highlighted. And I think that was all I really wanted to point out. The other tip sheet is structured the exact same way. I don't know if maybe anyone has anything to add on those, or
I would add administratively. So the grant writing toolkit is available to all Castor affiliated folks, and I sent it to anyone who registered by yesterday. So those of you that maybe registered today, I'll get that to you ASAP. And I actually went ahead and took the documents that you had, Ella, and there's going to be hyperlinks in there to those grants. So it's an easy way to just kind of refer back and forth.
Perfect. Looks like Stephanie has her hand up. Did you want to share?
Sure. Just one quick addition, Ella. I think that tool that you provided is fantastic. And quick addition, if an application that you submit does not go to a study section you request, take a look at the membership of that study section. And if you feel that the expertise that you think is needed is not there, reach out immediately to the SRO, the scientific review officer, and say, this really, can you please add someone who has expertise with, let's say, computational modeling or whatever it is. And you cannot recommend a particular reviewer, but you can ask that certain expertise be represented there. Do that as quickly as you can.
Oh, that's super helpful. Thank you.
Great. Thank you, Ella and Stephanie. And thank you all the panelists for being here and sharing your wonderful thoughts and advice. We're going to hand it over to David Mendes to close out the session. Go ahead, David.
Thank you, Ritesh. Thank you very much for joining us. As next steps, we have compiled a series of resources that are going to be helpful for our trainees to write their grant proposals. We will share this page with the links with you. For example, we have the great grant writing toolkit, and within that page, we'll have. Let me see if I can move this. Compile a list of for significant and innovation. We have a specific game prompt for our reviewers and writers. An example of what is on this list is something like that. Is the problem important, and the research is needed, and so on. So you'll have access to all that material. What we would like to right now close with is telling you what's next in our series of webinars and support for grant workshop and support for grant writing. So following this workshop, we need to we would like to follow up with either a workshop on today's topic or individual consultations with trainees that are writing proposals now. So if you prefer and one-on-one consultations with one of the panelists or senior faculty about your specific proposal, or if you prefer in general to have a workshop, please let us know. We will reach out to you to figure out your preference. We also are going to have next a panel on writing the approach section for TRS proposal, making the emphasis on this is for tobacco regulatory science. With that, we thank you again for your participation, and we look forward to continue this conversation. We thank very much to our panelists, Dr. Land, Dr. Tam, and Dr. Leventhal. Thank you very much for joining us and for being so helpful to our audience. And we look forward to keep collaborating with you. So very good afternoon.
Yes, thank you, everyone.
Thank you.
Have a great day, and we'll see you all around.
Bye.
Bye.